Good afternoon. I first want to address the staffing situation in residences for the elderly. We have already received a lot of reinforcements and more are coming. Today, we announced that we will add 400 militaries in 8 CHSLDs. This is good news, but we continue to ask for help. As we said in the past few days, outside of the CHSLDs, we have managed to flatten the contagion curve. But the key ingredient to the gradual reopening is to maintain the exceptional discipline that Quebecers have shown for almost 2 months. Prudence remains our watchword. It is in this logic that we are presenting today a plan for the gradual reopening of some of our regions. But we still ask Quebecers to continue to avoid unnecessary trips. Now is not the time to rush to shops outside your region. Unless necessary, you are asked to stay in the area where you are. We are announcing this calendar to allow people to prepare, but nothing prevents it from changing if the situation deteriorates. So we are making progress, but now is not the time to declare victory. Now is not the time to stop all our efforts of social distancing. We've been exemplary in the confinement phase. Let's continue on that path for the gradual reopening. Thank you.
Mrs. Guilbault, we're getting questions from some business owners who are wondering when they will be allowed to reopen, like barbershops, hair salons, gym owners, and others. When will the government have a timetable for them to reopen?
Those businesses are closed as we speak, and we are not in a position to give a specific date for that kind of business. We already announced yesterday our plan for some types of businesses, as you know, so detail stores and construction and other types of businesses, but we are not in a position as we speak to give dates for those kind of businesses, because if we talk about hairstylists, those are people who work really close to their customers, so we have to evaluate this situation, of course, with our good Dr. Arruda, who might be willing to add something about that.
Yes, in fact, we would like to give you the people the right date and make sure it happens that way. But as we have to control also the issues related to the protection because of distancing issues, even if we can find some things, we also have to control how many people get into circulation in a place. So it's why they are going to be later. I hope as soon as possible, and when we're going to go through, I would say, those first phases, and we're going to be in control of the situation, we will also probably project some dates.
Okay, quickly, and Dr. Arruda, do we have data to explain where transmission is happening in the community? Not within families or travelers, but how much spread is happening in stores or outside? Like people walking.
There is some. We know that it has been almost driven at the beginning by travelers, after in, I would say, healthcare settings like CHSLDs, and probably even some workers from there went into their communities and been infecting the community. Like if what you're looking in Montreal North, actually, there is a lot of staff of workers come infected from probably their work where there was, I would say, outbreaks. But we are going to be now, as we are going to open things, make some more tests in different settings and be more able to calculate what is exactly the transmission in the community.
Katsane, CBC.
Good afternoon. Mrs. Guilbault, you said we are reopening some gates, some regions gradually, but you ask Quebecers to stay disciplined, as if this is a taste of freedom, but stay still, stay obedient. What are your expectations from Quebecers after being in isolation for several weeks? How do you want them to understand your announcement today?
Well, Quebecers have been exemplary. They have had such a discipline from the beginning. That's why we are able today to announce this gradual and cautious reopening of economy, of schools, of services éducatifs, and today of regions. But to be able to maintain those projections and those plans that we have, Quebecers have to remain very careful and have to obey the directives from the national health, because if they don't, we might see an upgrade of the curve that we wanted to flatten, that we have been able to flatten. But if we see that the situation is deteriorating and that the curves has another update, we will have maybe to postpone some reopening, and we don't want that. So if you want stores and regions and schools to reopen as we planned that they would, comply with the directives, and we should be able to go on with the plan as we announced them this week.
But what do you say to Quebecers with the next regions reopening, like in the next coming weeks? If I wanted to go to do my grocery store in a different region, what do you say?
We still have to avoid unnecessary going from a region to another. So just because the region is reopened and that there is no more control of the moving, you must not go in those regions if you don't have a good reason to go, because we don't want people to go in another region to maybe get the virus there if it's not there already. So we don't want people to go from one region to another if they don't have a good reason to. We want people to keep up washing their hands, to stay at 2 meters from distance from other people, to keep protecting our vulnerable people, including our seniors. So we have to maintain those rules. It is important to be able to go ahead with the plan, with all the plan that we have for the reopening of Quebec.
Thank you. So the next question is from Phil Autier, Montreal Gazette. It's for Minister McCann. We are seeing Montreal hospitals cancelling surgeries. Hospital and ERs are now overcrowded. You have many beds occupied by people who cannot be moved back to CHSLDs. Is the situation under control?
Well, we're moving on the people who are in the hospital that can be moved elsewhere. Some emergencies, not all emergencies, are experiencing more overflow, and that's linked to probably the fact that they don't have enough beds for people to go into those beds, because they have people that should be elsewhere than in the hospital. So we are moving on that. And at this point, there's only one hospital who canceled surgeries today, and it's Maisonneuve-Rosemont. The other hospitals are going ahead. We have a plan to increase to 50% of our capacity surgery. For Maisonneuve-Rosemont, we will reorganize in the next few days, and we think that next week they will be able to increase their surgery. But again, all urgent surgeries, oncology, cardiac, everything is being done as it has been since the beginning, but we want to increase the capacity. And all the treatment that are becoming necessary are being done at this point in the network in Montreal.
The next question is also for you and Mr. Arruda. Can you please update us on the situation in Montreal CSHLDs? We would like an update on the number of jobs which have been filed. How many employees do you still need? How many residents have COVID-19 now? Do you think things are under control?
Well, again, we want to be very careful when we say this, because we want to be sure. But what we can say today is that we still have a lot of people who are away from work, but we have a little bit less today in our network and in Montreal, a little bit less. We have also have done a lot of work on the CHSLD, the long-term facilities. And with the Army coming in, and with also all the people that have called us on Je Contribue, We had thousands of people calling us, and we have hired thousands of people. It's getting a bit better. We're not over the situation, far from there at this point, but we see a small improvement. So what I'm saying is that I hope that next week I'll be able to tell you that there is a significant improvement in our CHSLD in Montreal. But people are working very, very hard, and I want to salute, really, again, the workers, because this situation has changed completely the way people are working in CHSLD and in hospitals. It's been a very, very demanding situation. But again, we're getting more people in, and we are seeing a slight improvement.
Thank you. Dr. Arruda, you want to add something real quickly?
The deaths, and I would say most of them are still in CHSLDs, but we are seeing the curve is going down, actually. Even if there is the same numbers every day, sometimes the cases that have been dying 4 or 5 days ago because of the system. So I hope that situation is going to go down, continue to go down. So I think by the end of the week, probably we will confirm that really the number of deaths per day is going down significantly, de façon significative. I'm sorry for that term.
All right, thank you. So quickly, two last questions from Raquel Fletcher, Global News. For Minister McCann, we continue to hear stories about staffing and PPE shortage in CHSLDs, about staff moving between institutions, about institutions without hot and cold zones, about limited or no access for caregivers. Do you have an update on the situation in CHSLDs? A little bit the same question.
Well, we're opening up access for caregivers, definitely. We have reviewed the question with Dr. Arruda and with Minister Blais, and we are opening up more. And as the situation in long-term facilities will improve, especially in Montreal, we will open up more, obviously. But we're opening up right now. And again, there's staff coming in, more staff from Je Contribue, from the Army, from education. We had some physicians helping us. So the situation is slightly improved, and we hope it's going to get better day after day.
Thank you. And real quickly, for Dr. Arruda, many restaurants owners are wondering if they should just go bankrupt now or wait to see if they can open this summer. What can you tell them about when you think it will be safe to open?
It's a good question. I would say I know that our Prime Minister yesterday told them to make sure they contact their banks or Development Economic to help them to survive. I understand the crisis. I understand the way they must feel for that. But everything will be depending on what is going to happen in the next days, week. And so I would just encourage them to not do banquet right now, if possible. Try to have some help, I would say, from your banks that should be comprehensive, but also there is discussion between banks and the government. And so it's what my Prime Minister told yesterday, and it's not my field, but make sure that I love restaurants. I want to go back to restaurants, and I hope as soon as we're going to be able to do that, we will.
And in the meantime, if I might add, just remind them that we announced measures to help all small businesses, including restaurants, so they can, if they have liquidity issues, they can use the program, the Programme d'action concertée temporaire pour les travailleurs of $2.5 billion, and they can ask for, we announced $150 million through MRC, so they can make a request to have for a loan that less than $50,000. So there are measures to help them in the meantime, but of course, as soon as we can allow them to reopen, we will.
Merci. Alors, c'est ce qui conclut pour cette conférence de presse. Merci pour votre disponibilité. On a fait un peu plus long qu'à l'habitude. Alors, merci et à bientôt.